Really, a crisis is anytime somebody is really in an emotional distress and they need support.
How to address mental health in our community is sometimes confusing for many people. Fortunately, our understanding of mental health-related issues is expanding. One of the benefits of that increased understanding is finding better ways to deal with mental health crisis situations. Jackson County has developed multiple programs and trained people that help diffuse or redirect situations to more positive outcomes.
Hello, I'm Bill Mance with Jackson County Close-Up, and we're here today with Rick Rollins. Rick is the program manager for crisis services here in Jackson County Mental Health. So thank you so much for spending time with us today.
Sure, thanks for having me.
So mental health crisis, that sounds really kind of scary. So what does that really mean exactly in the world that you're living in here at Jackson County?
So really anybody can have a mental health crisis. It doesn't matter, what your income level is, it doesn't matter where you live in the community. Anybody can have a situation that just overwhelms their current resources, whether it's emotional resources or what it may be. When somebody they need help immediately, then they can come in or call our 24/7 crisis line, 541-774-8201. And that is staffed 24/7 by our master's, PhD level clinicians. And they will be able to do a crisis intervention counseling service over the phone. During business hours, they can walk in here at our Hawley Street address, 140 South Hawley. But really a crisis is anytime somebody is really in an emotional distress and they need support. It could be a suicidal concern, or it could just be they're really having a rough day and they need some support at the moment, and we're available 24/7.
What can the person expect once they actually reach out for help?
So if they call on the phone, one of the things that we're going to do is find out what their concerns are, how can we best assist. We're going to do some level of risk assessment, determining whether or not there is a level of immediate suicide risk or maybe harm to others. If they come in for in-person services, then that's what our living room is for. So we have peer support specialists who are staff that are hired that have their own experience with mental illness, that they are able to give people the support they need really at the moment that they are here. So we will fix meals, we'll help them. If they need to take a shower, then we have linens and shampoo and soap and all that. But really we're here to address what their immediate need is, looking at some of the risk factors and doing a risk assessment, and then trying to connect them into ongoing services, whether that be here at Jackson County for ongoing services or connecting with our community partners.
So you've got a mobile crisis services group that they respond to mental health crisis situations, I'm assuming, out in the community. So tell us a little about that and that program.
Really what we are building is an increased response for law enforcement. So we have a full-time therapist that we have connected with the sheriff's office in order to respond with law enforcement when they are responding on a call. And really the issue is not a criminal situation that law enforcement needs to act on, but it really relates more to a mental health crisis. So our therapists can go out, at the time that the law enforcement are on scene, they can show up on scene as well and to assist, hopefully as a way to divert people from needing to go to the hospital, trying to get services where they're at the moment that they're having the crisis. And so we've always been able to do some of that, but now we're able to do it much more as we're pairing with the Jackson County Sheriff's Office and have a dedicated therapist.